Welcome to this video demonstrating exercises to help optimize the mechanics of your lower extremity and reduce your tendency to overpronate. My name is Carissa Conrad and I'm a doctor of physical therapy and therapeutic pain specialist, and I am the vagus nerve PT. The exercises that I'm going to show you today are widely applicable. They can be helpful for somebody with back pain, hip pain, knee pain, or foot or ankle pain. These are great exercises if you have plantar fasciitis, if you have arthritis in your knee, or for chronic back pain. The exercises are going to help improve your core strength as well as your hip strength to improve the way that your foot hits the ground when you're walking and decrease the tendency for your foot to flatten out through the arch. Now, the first thing that I always do when I'm working with somebody is encourage them to use vagus nerve stimulation while they're doing their exercises. And I have lots of explanations for why this is the case in other videos on my channel, but suffice it to say, it's going to help you access the stabilizing musculature and it's going to enhance the neuroplasticity. This is called targeted plasticity, using vagus nerve stimulation to help change the patterns in our brain that have kept us walking in a certain manner all this time. So I've got my vagus nerve stimulation on, and we're going to start with the first exercise, which is a neurokinetic therapy correction. This is going to help us access the multifidus muscle, which is the main stabilizing muscle in the spine. So the first thing that you're going to want to do is massage both sides of your low back. This doesn't have to be fancy. You're just massaging the muscles on either side of the spine. We're going to do this for 15, 20 seconds. With the neurokinetic therapy, what we're trying to do is change the patterns of muscle activation. Typically what happens is that the body starts to utilize the paraspinals in an attempt to stabilize the spine rather than relying on the multifidus. Now that I've done the massage, I'm going to lay down on my back. My legs are straight out in front of me. I'm going to turn both toes towards one another, and I'm going to press both heels down into the table. I'm holding that for about 5 seconds. Relaxing and repeating 2 more times. Now, the important thing as you're pressing your heels in is to do so gently. This exercise is meant to activate the multifidus. We are not trying to strengthen it. More is not better. Okay, I've done that. Now I'm going to do one side at a time. So now I'm going to massage the right side of my low back. Same thing, about 15 seconds, 15 to 20 seconds. We've done bilaterally, now we're going to do unilaterally. Okay, same position. Now I'm turning just my right toe inward and pressing my right heel down. Holding for 5, relax, and repeat 2 more times. Hold for 5, relax, and hold for 5. Relax. Now I'm going to do the left side. Massaging the left. Turning the left toe in, and I'm pressing my left heel into the table, holding for 5. Relax. Pressing again, holding for 5. And relax. And 1 more time. Remember to press gently. Good. Now that our body is using the multifidus muscle better, we can start to activate that multifidus and strengthen it. The multifidus muscle, as I mentioned, is the main stabilizing muscle in the spine. We need the multifidus to be working in order to hold the vertebrae stable and get all of the electrical impulse from those nerve roots that are coming out of the spine and supplying the muscles in the leg. The way that we fire the multifidus muscle is by using the pelvic floor and or the transverse abdominis. The pelvic floor is the bowl at the bottom of your pelvis. This is your voluntary control of bowel and bladder function. So what I want you to try first is just to activate that pelvic floor muscle. You're going to do this by performing a Kegel exercise. Otherwise, another way to think of it is like you're stopping the flow of urine midstream. So you're pulling up and in on the muscles in your pelvic floor. Okay? Now I want you to try to do that as hard as you can. Okay, let's imagine that's a 10 out of 10. 10 out of 10 intensity is as hard as you can pull those muscles in. You're going to feel your belly button draw into your spine as well. Now what I want you to do is cut that intensity about in half. So contract those muscles at about half of your maximum intensity. You can also think of it like you're pulling your belly button in, but you're not going to pull it all the way in, you're going to pull it about halfway in. Now see if you can hold that. And relax. That's what I want you to be able to do with the rest of the exercises that we're going to perform today. So go ahead again and contract that muscle at about half your maximum intensity. And then we're going to lay down on our backs and perform the next exercise. So pelvic floor, belly button in at about half your maximum intensity. And we're going to start by lifting the arms one at a time. So now we've added weight to the exercise, and we're challenging the multifidus to stabilize the spine with movement. This is what that muscle should be doing at all times. So we're going to keep going here. We're going to do 10 on each side. And 10. Good, now relax. Let everything have a break. The next thing that we're going to do is the same style of exercise, but with the feet movement. So I'm going to have you do the same thing with the pelvic floor and transverse abdominis to help engage that multifidus and stabilize in your spine. So bring those muscles in at about half of your maximum intensity. And now we're going to lift one foot at a time as though you were marching. So my pelvic floor and transverse abdominis are engaged. Lift a foot, down. And we're going to do the same thing, 10 on each side. Here's 2, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Excellent. Now, the goal, like I said, is to improve the strength of that multifidus muscle and to challenge it by requiring it to stabilize in the spine while you're moving your extremities. This is a crucial piece to improving your mechanics as you're walking. The next exercise is going to target the gluteus medius muscle. Now, gluteus medius's job when you're walking is to hold your femur bone, so this thigh bone, straight up and down. When gluteus medius is weak, what happens is the femur tends to adduct and internally rotate. So in other words, your knee kind of comes in towards the other knee. That translates down into that overpronation in your foot. Now, in order to get all of the strength out of the gluteus medius, we've got to involve the multifidus muscle. This is because the gluteus medius is innervated by the L5 nerve root most heavily. So we've got to have the multifidus firing to stabilize that L5 vertebrae so that we can get all the electrical impulse from L5 into that gluteus medius. So we're going to incorporate that multifidus contraction with the pelvic floor and transverse abdominis with our exercise for gluteus medius. Now, this exercise is called the clamshell. Many people are familiar with the clamshell. I'm going to be very picky about your form. So, on our sides, my knees are bent, feet are together. I'm going to bring my top hip forward so that the hip bone on the top hip is in front of the hip bone on the bottom. Now I'm going to draw in my belly button and pelvic floor to that halfway point again. Keep that contraction, and we're going to lift up and down with the top knee. Okay, we're going to do 10 times. It should be hard. If it's too easy, your hip is probably not rolled far enough forward. And there's 10. Okay, take a break. So you can see when I relax, my hip rolls back, right? Your body's gonna wanna try to make it easier by rolling your hip back. Don't let it, okay? One more time, forward with that top hip. Engage that pelvic floor and draw your belly button in and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. If you can't get through both sets of 10 without rolling your hip back, that's okay. Start where you can and work your way up. All right, we're going to turn to the other side and do the same thing. Okay. Top hip is coming forward, pelvic floor, transverse abdominis engaged, and lift. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Take a break. Feel free to pause the video if you feel like you need a longer break. And again, 1, 2, 3, 4. Make sure your pelvic floor is engaged. 5, 6, 7, 8, 9, and 10. Excellent. Those 3 exercises are a great place to start. Stay tuned for more videos with more advancements, and thank you so much for watching. We'll see you on the next one.